5 signs you might be missing a critical illness. Don't wait for cardiac arrest. Imagine this scenario. You're packing your bags to leave after a routine checkup, when unexpectedly, your health deteriorates significantly. Early recognition of a critical illness can mean the difference between life and death. We're exploring the 5 critical signs that are frequently overlooked, but may indicate a severe medical condition developing. So, prepare yourself, take a notepad, and get set to learn how to manage your health. Let's begin. Let's discuss an activity we perform unconsciously: breathing. When we talk about respiratory rate, we're talking about the number of breaths you take each minute. The normal resting respiratory rate for adults is usually between 12 and 20 breaths per minute. Any significant increase, particularly with difficulty breathing, may indicate respiratory distress. Possible causes include infections like pneumonia, chronic conditions such as asthma, or a blood clot in the lungs. If your breathing is persistently faster than normal, accompanied by shortness of breath, chest pain, or a bluish tint to your lips or fingertips, take it seriously. These red flags require immediate medical attention. Next, we address a silent threat that often goes unnoticed until it's too late: blood pressure. Blood pressure is the force exerted by your blood against the walls of your arteries as your heart pumps. Hypertension, or high blood pressure, is often asymptomatic, which is why it's called the silent killer. It places significant strain on your heart and blood vessels, raising the risk of heart attack, stroke, and other serious issues. Conversely, low blood pressure, hypotension, can cause dizziness, fainting, and in severe cases, shock. A narrowing pulse pressure, the difference between systolic and diastolic pressures, can indicate potential heart problems. The takeaway here is simple: know your numbers. Regularly monitor your blood pressure at home or at your local pharmacy. Keep your doctor informed of any significant changes or concerns. 3. Heart rate. Listen to the rhythm of your heart. Your heart rate, measured in beats per minute, is a vital sign that offers important insights into your overall health. A normal resting heart rate for adults typically ranges from 60 to 100 beats per minute. Persistent tachycardia, fast heart rate, and bradycardia, slow heart rate, can both indicate potential health issues. Tachycardia may indicate underlying issues such as dehydration, hyperthyroidism, or heart arrhythmias. Bradycardia, though less common, may signal issues with the heart's electrical system or other health problems. Be aware of your baseline heart rate and notice any significant or persistent changes. If you have a racing heart that remains fast despite rest, or if your heart rate consistently falls below 60 beats per minute, take it seriously. 4. Temperature, fever, or freeze. Both can spell trouble. A fever is generally defined as a body temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. It's often a sign that your immune system is working hard to combat an infection. While a mild fever is usually nothing to worry about, a high fever, especially if it persists for more than a few days or is accompanied by other symptoms like severe headache, stiff neck, confusion, or difficulty breathing, warrants a call to your doctor. Hypothermia occurs when your body loses heat faster than it can produce it, causing your core body temperature to drop dangerously low. Any significant deviation from your normal body temperature, whether it's a spike or a dip, should be taken seriously, especially if it's accompanied by other unusual symptoms. 5. Oxygen saturation, the silent indicator of trouble breathing. Oxygen saturation, often measured using a pulse oximeter, tells you how much oxygen is being carried in your blood. A normal reading typically falls between 95 and 100%. A drop in oxygen saturation, also known as hypoxemia, means your body isn't getting enough oxygen to function properly. Hypoxemia can lead to shortness of breath, confusion, rapid heart rate, and in severe cases, organ damage. The tricky thing about oxygen saturation is that it's not always obvious when it's low. Be aware of the warning signs and seek medical attention promptly if you notice any of the following: a bluish tint to your lips or fingertips, confusion, rapid breathing, or chest pain. Early intervention is key. And there you have it, 5 key signs that you should never ignore. We've covered respiratory rate, blood pressure, heart rate, temperature, and oxygen saturation, all vital indicators of your overall health. The sooner you recognize a potential problem, the sooner you can seek help and potentially prevent a medical crisis. Subscribe to our channel for more valuable insights and tips on health and wellness. Share this video with your friends and family to help spread awareness and empower others to take control of their health. Stay safe and stay healthy.